What if we could showcase the possibilities around the ownership for your health? I'd like to welcome Kevin to the Design Your Legacy podcast this lovely morning. Welcome, Kevin.
Thank you for having me, Angelina. It's a pleasure to be here.
Thank you so much for joining. You're joining today from Switzerland across the pond. So, welcome.
Thank you so much.
Yes. Would you share with the listeners a little bit of background regarding yourself personally or professionally in terms of the origin of SIP, or where would you like to start with the listeners this lovely day?
Yes, of course. I'd start on the personal side. I've always been very fascinated and interested in health and well-being in general, just because it's a fascinating topic overall, but also because of a few experiences that we've had or I've had in the healthcare system, which have brought me to, come to SIP and sort of find my purpose. When I was 18, for example, and I was still doing my military service at the time, I caught an ear infection, and it was treated very badly at the time over several weeks by the doctor that was dedicated to our military troop at the time, until I then started to basically take ownership of my health and demanded to speak to a specialist on the subject matter. But unfortunately, by the time it was already too late, and I was diagnosed with a tinnitus, so a ringing in my ears. And while this is comparatively to other cases a very minor case of medical malpractice or not taking full ownership of your health, it still is quite a significant loss in quality of life. So actually quite immense, because for the rest of my life I'll never be able again to go to bed and go to sleep basically enjoying pure silence, because there will be this ringing in my ears for the rest of my lifetime. And so that's sort of where I have found my purpose in trying to help people navigating in the healthcare system, and to create as well the awareness and the education about what you need to be aware of when entering that healthcare system, and the ownership that you have to take when it comes to your health. So that's where I sort of got interested and involved in that business. And today, with today's knowledge, I can manage and navigate through such complications. But many other people are not aware of it or don't know how to navigate through that. So that's where I find my purpose at the SIP Medical Family Office.
Yeah, thank you so much for sharing that backstory. I think a lot of the times people kind of stumble into their healthcare decisions. Nobody wakes up one day and says, "Oh, I'd like to have a ring in my ears," or "I would like to, get blindsided by a ski accident while skiing in Aspen or in Switzerland in the Alps or some type of scenario." And I know we're going to talk in a moment about what it is to travel to a new city and what it is that is so important to know. So thank you for sharing that. I know one of the things that we talked about in our preamble is just the value to this type of knowledge and understanding how important it is to get a second opinion when that's available, as well as a third opinion. And a lot of times people don't know that there is such a thing as a medical family office that has a network of medical professionals, surgeons, and physicians. So let me pivot the conversation for a moment regarding the state of the healthcare system today. What's working, what's not working, and what's important to know?
It's a very big question that I'll answer possibly in two different parts, or from two different points of view. So one is you can look at today's state of the healthcare system from the point of view of a nation. So putting yourself into the shoes of a health minister of a country. But then on the other side, you can also look at it from the perspective of a private individual or a patient entering that system. And so when you're looking at the national perspective, the global perspective, what you see in most countries is that you have a very, very complex system with a lot of stakeholders and participants that are actually incentivized to benefit from illness rather than from health and well-being, which is something that you typically should be aware of as a patient. But to give you a few examples. We see, for example, as a key stakeholder, obviously, of that system, the healthcare providers themselves. So, medical facilities, whether that's clinics or hospitals, or then as well doctors, nurses, etc., that are to a certain extent under financial pressure, as it is the case with a lot of healthcare institutions. And those institutions have financial targets that they need to reach to continue to survive. And this usually then breaks down as well to departments and doctors that have targets for certain interventions or treatments, such as MRIs, for example, which are a very good example for that. So if you have a very expensive MRI machine infrastructure at your clinic, you need to make sure that this is regularly used. Otherwise, you're going to make a big loss out of it. And so that leads to the fact that MRIs in particular are very often overprescribed. Even though they might not necessarily be needed, they are suggested just because of the way the healthcare system is set up and incentivized, which not always is in the benefit or in the interest of the patient in the end. And on the other end, you have an insurance system, whether that's a state insurance system or private insurance, which as well is very often dictating what medical care someone receives. Now, we all know that, if you're privately insured, you usually get access to more senior doctors, you get more time, you get faster availability. But on the contrary, what very few people are aware is that if you're a privately insured patient, you are at much bigger risk of being overtreated. For example, some stats out of Switzerland, we know that there's around 1/3 more heart surgeries with privately insured people compared to people that are just in the national healthcare system. And another example, we see that there is around twice as many elective C-sections in one of the richest cantons of Switzerland compared to some of the poorest cantons in Switzerland. And that's not because the biology of the women in one canton compared to the other is so much different that they require more C-sections. That's primarily because you have more privately insured patients in that richer canton. And because a C-section is much more attractive to the healthcare stakeholders, as in the healthcare providers, because it is more rewarding financially for a clinic or for a doctor, but also you can avoid night shifts and emergencies because it all becomes plannable. So you have a lot more C-sections because of health insurance incentives, even though a natural birth in many cases would be much more sensible from a health perspective for a newborn and for the mother.
Yeah, it's so fascinating to hear this kind of the backstory of what is motivating the medical decisions. And so I think starting out, even with the intention we set for today's conversation, is it the individual that will take ownership of their health, or will it be the insurance companies and the financial motivations and the financial drivers? And I think this is the moment to get educated on this subject. We all know that the affluent are incredibly busy. They've got companies to run, families, oftentimes investments. They're oftentimes traveling all over the world. But I think this conversation is so important because when somebody realizes that they can take ownership of their health, starting with even some of the tools you're going to speak about in a moment, it puts them in the driver's seat in terms of personal agency. And it's not just kind of willy-nilly at somebody else's disposal of the financial metrics that they need to meet, whether that's the hospital or the institution where they are at. I wonder, do you have an opinion if, especially speaking about high net worth individuals, they're traveling, they have business meetings all over the world. Would you say that maybe medical attention is better in Dubai compared to the United Kingdom, Monaco? Is one or the other better, or does it just depend?
Definitely a difference in the quality of healthcare that you get if you compare across the globe in different countries and cities. There are certain centers of excellence that you can, which you can approach, but it very much depends on an individual case. So it depends on the diagnosis or the symptom that you have, on the type of specialist or treatment that you're looking for. So it's extremely individual and much more important than the country or even the hospital in the end is the consulting practitioner. So who is the doctor who's giving you advice? Who is the surgeon who's performing your surgery? Which is determining to a large extent what is the outcome of that treatment or that medical event. Because people are very often thinking in terms of big brands and hospitals and private clinics. But it's fine if you're at a super high-end private clinic, but you are with a junior doctor, which might happen less often than when you're going to a state hospital or state facility. But in the end, it's very important that you know who is the doctor who is advising you and who is doing your surgery. So that's absolutely the key element when deciding where to go.
Yes. Before we speak about what SIP, Medical Family Office, offers to their clients, what is it that the affluent community is talking about these days? Is it the mental health aspect, given the stress, the pressure we feel? It seems like the economy is running faster and faster. What is it when it comes to the kind of the grapevine?
I would put forward two points or two elements that are very hot in the press at the moment in the affluent community. One you've already mentioned, which is mental health, which is a very, very big topic and mostly related to anxiety and then as well addiction. Because a lot of people would typically think that if you're born into an affluent family, you are in the best possible circumstances to grow up and to develop because of the wealth and the access and the privileges that are there. But when it comes to your mental health, very often it's actually quite the opposite, because the chances of you to experience true success, personal fulfillment, or development of an own reputation or friendship are very much lower if you compare it to, I would say, an ordinary person. If you take an example, an ordinary person is founding a startup and is developing that and eventually selling it for, say, 10 million or 20 million US dollars even. If you are an ordinary person achieving that, you are an absolute hero in your circles and you are on cloud nine. Now, if you are born into a high net worth family and you're going to achieve that, everyone around you will very likely say, or at least think, this is because of your family connections. This is because of the funding of your parents. This is because of the help and the network of your parents. So it diminishes that achievement, that feeling of success quite drastically. And so people are much more in a position where they experience mental health issues that are then as well related often with addiction, whether this is substance addiction or any other type of addiction.
Yeah, it's so interesting. Also, the expectation of, let's say, little Timmy or Mary, that next gen family member, there's also that expectation of, oh, they finally did something amazing with their life. Yeah, like they can't
Yes.
just be a school teacher or
Yes, the expectations are so incredibly high, and it's extremely hard, especially for the younger generation, to meet up to the expectations or the levels that were set by the previous generation, because everything is already there, everything has already been achieved. So what do you do next? How do you establish yourself with your own personality? So
an
this is
identity.
clearly. one of the top topics. And the second topic that I'd like just to briefly touch on is longevity, which is a buzzword that has been around in the industry for probably around the last 3 to 4 years, and it's a very big trend. And a lot of clinics, you would see that with a lot of supplementations and treatments, you would see it as classified under the term longevity. Now, what is important to understand is how do you define longevity? What is often times it is thought that it's the wealthy community that just is trying to get to 120 years of age or 130 by all means, but this is definitely not the case. What longevity means is maintaining the highest quality of life for as long as possible. So rather than being the last 5 or 10 years of your life in a state of cognitive or physical incapacity, you would like to spend those very same years in a quality of life where you can actually enjoy. You can enjoy your friendship, you can enjoy the business that you've built, you can enjoy your family. So this is very important when we talk to understand when we're talking about longevity. So this is definitely a key topic in the high net community. And I think what everyone has in common is the understanding that health is an absolute priority, because especially those people know and have experienced that once you lose your health, you lose everything. No matter how much money you have, if you are bedridden, if you cannot go out and enjoy what you have achieved because of a disease, because of a symptom or a diagnosis, then you basically lose everything. It doesn't matter how much money you have, how much businesses you have developed. So health is an absolute key priority in those communities.
Yes, thank you so much for sharing that. I think that somebody always would like to see their friends and be able to go out to have their social life and enjoy the quality of life that you had mentioned. The sunshine is out. You shared that summer is coming now in Switzerland. All of those things are very important. They make life meaningful. So, whether it is the evacuation aspects or complex surgeries and so forth, how does your medical family office provide support for the high net worth clients?
It is very individual, and it very much depends on what situation a person is in and what are the needs and the demands of a person, and what type of membership a person has taken out with our SIP Medical Family Office. But to put it into a nutshell, we basically plan and organize people's health and well-being in the same manner as a traditional family office would plan and organize a family's wealth and the financial structures. So we handhold people through the healthcare system, and we've developed an approach or a methodology for health management, which is based on 5 different pillars, which I'll just briefly touch base on. So the basis is always medical records management, so making sure that you're householding and that you're taking ownership of your data, not just for yourself, but your whole family. So you have an experience of the risk profile that exists actually within the family. And from there, you build towards the second pillar, which is preventive medicine. So, with that knowledge from that medical records management, owning that medical data, you can then have personalized health checkups to prevent of actually experiencing symptoms or diagnoses that possibly were experienced already in your family. So you build from there to basically prevent illness and to as well achieve longevity to a certain extent. And then there is 3 different elements, which is 2 are more administrational. So insurance, which is definitely very key for global citizens when we're talking about international private medical insurance, because people are relocating once or twice or even more in their lifetime, and you need to have continuity of full coverage. And what we would term, what we would call patient guardianship. So making sure that you have established your medical will, that your family is aware of that, your family doctor might be aware of that, and they can execute on your medical will in case of incapacity, which takes out or takes away a lot of stress from the family in such critical situations when you're unable to decide for yourself. And then, obviously, what is a very key pillar is what we call privileged healthcare, which basically is our medical concierge service. So, making sure that people are guided through the healthcare system in the right way. They connect with the right hospitals, the right doctors. They follow the right procedures to make sure we achieve optimal health outcomes when someone is experiencing an event of illness.
Yes. So, how does your medical family office find the best surgeons, physicians, medical professionals, nurses, etc.?
That's a very good question, and I don't think I can give away all of our trade secrets, but I can maybe give you some indication about how we do that. And we typically have three different approaches to that. So one approach is our internal vetting of doctors that we work with based on our experience of their mentality, of their work ethics, of their morals, because that's quite important for us that when we speak or our clients speak with doctors, you are in safe hands in terms of someone who is truly there to help you and is not being trapped by the incentives of the healthcare system that the healthcare system is basically imposing on everyone that's navigating in it. So this is our own vetting system that we have. Then a second approach, which actually is something that every family office itself could look at and explore when needed, and you don't need an SIP medical family office to do that for you. Say, for example, if you are looking for the best cardiologist in London, a cardiac surgeon, you might be well advised to approach three different surgeons, have a conversation, and ask them, with whom would you do your cardiology surgery, your heart surgery, if it was for your own? And ask people to share two or three names. And if you do that two or three times, it's very likely that you'll have a crossover and you will find a match of a surgeon that's highly recommended by other surgeons. So this is actually quite an effective tool to find out because those say the healthcare industry and especially the network of doctors, they're actually quite close grid and networked, and they themselves within the community know very well which doctors are successful in their therapies and who might have more complications or difficulties with treatment. And the third one, which is absolutely key, is experience, because only once you experience how a doctor or a healthcare practitioner is acting, you can basically build on that relationship. Now, very luckily, not all of us are going through, three different heart surgeries throughout our lifetime or three different cancer cases through our lifetime, which is very, very nice. So that's extremely, we're extremely lucky that we're not having to do that experience. But as well, it puts you in a position where you cannot test and try yourself when you are in that situation of requiring that treatment. And now, because we've been doing that for quite a while, we do have a bit of a track record on experience, and that's very much what we build on as well, recommendation and the network of medical practitioners that we work with.
Yes, it's so interesting. I think word of mouth, especially in terms of tight communities, it I think the starting point oftentimes is who do you trust? And then you kind of build from there. What's important to know when one travels and what do they need to carry?
Yes, health management also has a lot to do with risk management. There is very similar, a lot of similarities, and one of those risk management aspects is as well having a contingency plan available when required. So when you're traveling to a foreign city or to a foreign country, you would do very well in making sure that you're informed about to which hospital or to which doctor do you go in case of an emergency or an acute situation. And you should do that research in advance, because in the state of emergency, you might not anymore have the possibility to do that research and decide, because it actually does matter whether you're ending up in hospital A or hospital B, in Taipei or in London or in Bangkok or wherever it is. So owning that responsibility and preparing for that is absolutely key. And then the second part, what is very important as well, is again data. So what our clients would always carry with them is what we call our SIP medical emergency code, which in essence is a system that keeps your emergency data that you have available at all times, because access to that information is absolutely crucial in an urgent situation, whether it's about dependency on medication, whether it's about emergency contacts, whether it's private or as well medical emergency contacts, your insurance contacts, who do you call when you need to plan an evacuation. So all of that information should be readily available at all times, especially when people are traveling.
Yeah, I think that's brilliant. And I think when it comes to designing a legacy, the health is number one. If you don't have your health, you don't have anything. And so if somebody can have their health intact, whether that's preventive measures, finding out the best hospitals prior to traveling to a new city, or just having all of this organized ahead of time proactively, just equates to designing a better legacy. So speaking about securing one's medical data, what's important to know? Does your firm have a crypto wallet? And what can a client do? Let's say if they become incapacitated, how do you navigate that?
Yes, I mean, client data is a very sensitive topic, and it is very much different from one person to the other how people are viewing that. Especially people with a public profile, whether it's an athlete or whether it's say a shareholder of a big company or a management person of a big company. It's extremely important to make sure that this data is secure, and those people will be extremely sensitive to making sure that, for example, not even the true name or a correct address will be indicated to a clinic or to a doctor when they're looking to get medical care. So this is a topic that's quite sensitive for one part of the community. Very interestingly, also in the high net worth community, there are individuals who couldn't care less. So they would much rather send to a doctor their medical reports by WhatsApp than using an end-to-end secure mailing system, for example. Um, but overall, what is again key is taking the ownership of that data and making sure that it's readily available when required, and it's not spread across the globe with maybe one doctor in Athens, one doctor in New York, and one doctor in Asia. So making sure this is centralized and readily available is absolutely key.
Brilliant, brilliant. So since this is a legacy podcast, what does the word legacy mean to you?
Obviously, I'm still a bit of the younger generation, so legacy is not something that I've thought about very extensively. Yet, for me, it's more about my mission at the moment. So I'm very much on my mission, but as well overall SIP at its mission to navigate people through the healthcare system, and in particular to make sure that medical incidents that could be avoided are not happening, because I've experienced it myself, how it can impact your quality of life. And we are on the mission to make sure that no one else will need to experience that in their life, because it's quite significant. So this is the mission that I am on at the moment, or SIP is on at the moment. And we might be able to talk again in 5 or 10 years and have a broader conversation about my legacy.
Yes. Well, I think it's just so fascinating. I think that when somebody can get it right regarding their health, how much easier it is on their life in their lifetime compared to having to go back and fix something because the first doctor didn't get it right in terms of medical malpractice or medical maltreatment. And again, until somebody's walked in the footsteps, this is a theory compared to it becoming real. But gosh, if somebody can do it right the first time, how much better it is for them. If you were to design a legacy hardcover coffee table book, what would be in its pages?
Actually, something that we have in mind, or partially have been working already on for quite some time. We're thinking about a book that's well suited for everyone's coffee table, but also fits into the library of all medical practitioners. And it will definitely be in the lines of a lifestyle and healthcare advisory guide. Um, how to achieve longevity with means that are actually sensible. So avoiding nonsense longevity treatment, for example, whereas there is a lot of, say, longevity treatment out there at the moment, which we're very, say, hesitant or conservative about, because we don't know yet whether it's going to how it's going to turn out in 10 years or 15 years, whether this is going to have any side effects, but rather making sure that you work on the basis of those pillars upon which SIP's methodology basically was built. But then as well, for example, sometimes rather simple situations or elements, such as in the older life, having purpose and friendship, because being lonely and without a purpose, especially in the higher age, is as much as a risk to your health and a risk for death as any other clinical reason that there is. But this is something that no doctor will ever advise you on, because simply it is part of your own responsibility and ownership of health. But as well, it's not a service that you can sell.
Yeah, it's fascinating how much access to information and also personal agency matter today. Somebody really needs to take ownership of their health because there are some things we can delegate, but this is one area that we can't delegate. We truly need to take responsibility of knowing our body, knowing who we surround ourselves with, and also, like you had said, knowing our purpose. Any closing thoughts?
Yes, I mean, definitely. What I would again say is, take ownership of your health. It is absolutely key, because you cannot expect that the healthcare system is taking that ownership off your shoulders. As we know, and everyone who's sort of looking into the healthcare system more and more, you realize that this is a system that's primarily set up to work in its own interest and not in your interest. So you have to take that ownership. And for anyone who might be interested in learning more about the subject matter, feel free to reach out to Angelina or to myself. I'm always very curious to have those conversations with interested people. But then as well, we have our SIP Global Health Conference on the 26th of June 2024, which will address all those main concerns of the affluent community, which will be about addiction. It's going to be about health management best practices for family office. It's about planning for a medical emergency, etc., etc. So anyone who is an interest is most welcome to join as well at our conference and learn firsthand from the scientists and doctors and advisors in the industry.
Kevin, I would just like to take a moment to thank you for being a guest on this podcast this lovely morning. I thought there were a number of key points that were incredibly valuable that you had covered, whether it was the five pillars of records management and the risk profile to the preventive maintenance aspects, as well as the administrative perspectives regarding insurance and if one relocates around the world during their lifetime. Fourth, regarding the five pillars, you spoke about the patient guardianship and the value of a will and getting all that documentation done ahead of time. And fifth, this idea of privileged healthcare. I think that the idea of retaining a medical family office is something that somebody might not have considered a decade or two ago. But I think as the world becomes more global and people travel more, I think that it just becomes another asset that somebody who is affluent needs to consider. So thank you so much for being a guest. And I'm just going to read a closing paragraph. And I will include the notes regarding the upcoming conference in London. So thank you so much again for being a guest. So, in closing, I'm Angelina Carleton, the hostess of the Design Your Legacy podcast, as well as the founder of Legacy Planning, a boutique coaching and advisory firm based out of Beverly Hills, California, but international in those I consult. I hope to dive deep into subjects that can help a person define, develop, and execute their legacy, and continue to scour the landscape for those who can be great resources to every dimension of your legacy. For many listeners, there can never be enough education or preparation in the moot or moat around your castle. Whether you find yourself with new wealth or generational wealth, may the content on this channel be an anchor in any storms ahead. We do our best to provide original content for your intellectual and emotional curiosity. Thank you so much for joining us today. And if you're tuning in on Apple Podcasts, Spotify, or SoundCloud, please remember to rate and review, share with your family and friends, and if you'd like, send an email to either Kevin or myself regarding your thoughts about today's conversation. Also, we might also be on YouTube. So again, feel free to share a comment. So thank you so much for joining us this week and for Kevin for speaking into your legacy. Thanks so much.